So, what's up? It's me. Me. I look washed out right now, and guess what? I kind of am. It's like 2 a.m. right now, and I've quite literally been studying for 11 hours since I woke up and went to my class, and then I just went to the center, studied chemistry, and now I'm studying anatomy, and I have my anatomy exam tomorrow. Oh, guess what I just did? I just scratched myself and now I'm bleeding. That's amazing. Anyways, we're here to review the material for tomorrow's exam. It's 2 a.m. right now and I have an exam at 9, so that's amazing as well. So let's see if we can get all this done by 3 so I can sleep for maybe 5 hours. Okay. Stuff. We're gonna start with has the skull online, I think. Because I don't know, my thing logged out. So okay, after this lag, I think I have to say whatever I have to say. So we have the axial skeleton, the appendicular skeleton, and the axial skeleton. We go to the skull, the vertebral column, and the thoracic cage. So the skull is the most complex, has 22 bones. There's the cranial bones with the calabria as the roof, the frontal parietal occipital. In the base has the ethmoid, temporal, sphenoid, and also parts of the occipital. Facial bones involve the zygomatic, lacrimal nasal, inferior nasal, palatine, maxilla, vomer, and mandible. The cranial cavity orbits oral, nasal, and paranasal sinuses. The internal view, we got the cribriform, the crista galli, part of the ethmoid bone, and the sphenoid bone with a depression called the sella turca, optic canals, and the internal acoustic meatus. The sutures involve the coronal, which splits the anterior and posterior. The lambdoid is between the parietal and occipital bones, and these contain Wormian bones, which are independent bone ossification centers. The sagittal suture is between the left and the right parietal bones. The squamous suture is between the temporal and parietal. So we got the orbital nasal and paranasal complexes. These humidifies and warms inhaled air, causes skull bones to be lighter, and provides resonance to your voice. So the bones associated with the skull, these are auditory ossicles. There's 3 tiny ear bones called the malleus, incus, and stapes within the temporal bone, and also the hyoid bone, which is between the mandible and larynx, which are attachment sites for the tongue, larynx muscles, and ligaments. So it's like right here, and it's not touching anything except for your neck. So the aging of the skull, cranial suture is almost fully developed by age 5. Posterior fontanelle closes around 9 months, and the anterior fontanelle closes about 15 months. There's 3 conditions we can get into. Cleft lip involves incomplete fusion of the upper jaw and a split upper lip. The cleft palate is a congenital fissure in palate midline, and the left and right maxillary and palatine bones are incompletely fused, and these sometimes occur with cleft lip. Craniosystem, Craniosynostosis, I guess, is premature fusion of one or more cranial sutures. Okay, now we're gonna move on to the vertebral column. There's 24 individual vertebrae and a fused sacrum and coccyx, basically your toe bone. So the cervical vertebrae, we only have 1 through 7. The atlas supports head, permits nodding yes, and there's no body and spinous processes. And the axis, which is C2, pivot for lateral rotation and permits you shaking your head no. The thoracic vertebrae has 12 and they're heart shaped. The lumbar vertebrae have 5 and it's the largest and thicker oval body. The sacrum is S1 through S5 fused into 1, and the tailbone is CO1 through CO4. We got 4 spinal curvatures: the cervical, thoracic, lumbar, and sacral curvatures. The primary curvatures are at birth and are C-shaped, and the secondary curves are after birth, which involve the cervical and lumbar. Okay, so we got 5 conditions. Kyphosis is an exaggerated hunchback look and results from osteoporosis. Lordosis is exaggerated swayback and may result from added abdominal weight. Scoliosis is an abnormal lateral curvature. The tailbone injury, I'm bleeding really bad. is prone to the tailbone is prone to bruising or fracture, involves severe pain, and it slowly heals. Herniated discs are well, just cervical lumbar disc being herniated. And treatment options can be involving microdiscectomy, which is a portion of a disc removed, or discectomy, which is a vertebrae muscles incised before removing portions of the disc. The thoracic cage involves 12 ribs, 7 true ribs with costal cartilage, and 4 false ribs, 8 through 12, and 11 through 12 floating ribs without a connection to the sternum. We're moving on to the appendicular skeleton. We got upper limbs, we got a humerus, radius, and ulna connected by an interosseous membrane, which is dense regular connective tissues, 8 carpal bones, 5 metacarpal bones, and 14 phalanges. The lower limbs involve 1 femur, 1 patella, which is the knee, 1 tibia, 1 fibula, 7 tarsal bones, 5 metatarsal bones, and 14 phalanges. We got 2 conditions. Pes planus is flat feet, which is basically the natural arch of your foot is flattened. Metatarsal stress failure results from repetitive pressure, and runners are especially prone to this. Moving on to the pectoral girdle, we got the clavicle, which is the collarbone, and the scapula, which includes the spine, acromion, and the coracoid process. The pelvic girdle, the differences in the female pelvis means the pelvis is shallower and wider. They have a pre-auricular sulcus, and the sacrum is shorter and wider. Next unit, we have a muscle. So skeletal muscle is voluntary, vascularized, and innervated. The functions are movement, maintenance of pressure, protection and support, regulating materials, and heat production. The characteristics are excitability, conductivity, contractility, extensibility, and elasticity. A whole muscle contains many fascicles. A fascicle contains many muscle fibers, and a muscle fiber is a muscle cell. There's 3 tissue layers of wrapping. The epimysium, which is dense irregular connective tissue, wraps the whole muscle. The perimysium is pretty much the same thing, but it wraps the fascicle, and the endomysium is areolar connective tissue wrapping individual fibers. A tendon is a cord-like structure of dense irregular. Aponeurosis is a thin, flattened sheet of dense irregular, and a deep fascia is a dense irregular superficial to epimysium, and it separates individual muscles. And the superficial fascia is areolar and adipose connective tissue, superficial to deep fascia, and separates muscles from skin. The origin is the bony attachment at the stationary end, and the insertion is the bony attachment to the mobile end of the muscle. And then we have parts of the muscle cell with a sarcoplasm and a cytoplasm. Muscle cells are multinucleated. Sarcolemma is the plasma membrane. There's T-tubules. Myofilaments are contractile proteins within myofibrils. There's 2 types of myofilaments. There's thick filaments, which contain myosin, and thin filaments, which have myosin, but also F-actin and G-actin. Elastic filaments have titin and attack filament to the Z-disc, which prevents overstretching, and there's at least 7 other accessory proteins that include dystrophin. Okay, so myofilaments are arranged in repeating units called sarcomeres, overlapping thick and thin filaments. These give rise to I bands, which are thin and get smaller as the muscle contracts, and A bands, which are thick, overlapping by thin filaments, has an H and M zone, and is the center of a sarcomere. And this is delineated at both ends by Z disc. The H zone is only thick filaments and disappears with maximal muscle contraction, and the M line is the middle of the H zone and is the attachment site for thick filaments. Muscular dystrophy is when skeletal muscles degenerate, and the Duchenne muscular dystrophy (DMD) is the most common type. So energy, you can either have that by sorry, give me a second. whatever, we'll move on. Innervation of skeletal muscle fibers. Small motor units have less than 5 muscle fibers, and these allow for precise control. And large motor units have thousands of muscle fibers, and these allow for a large amount of force but not precise control. And a neuromuscular junction is a location where the motor neuron innervates the muscle, usually at the mid-region of the muscle fiber. It has a synaptic knob, synaptic cleft, motor and a motor end plate. Moving on to the next unit, there is 4 major phases of contractions and relaxation. There's excitation, contraction coupling, contraction, and relaxation. So voltage is basically electrical potential, and it involves a resting membrane potential, which is about 90 millivolt. It should be 70, sometimes 70 and 90, but we'll explain it later. So there's more anions on the inside than the outside. There's excess sodium in the ECF and excess potassium in the ICF. So the cross-bridge cycling has 4 repeating steps. So there's a cross-bridge formation, which is myosin attaching to the binding site on actin. The power stroke, which is the myosin head pulls thin filament towards center of sarcomere, and which releases ADP and pi. And then the release of myosin head, and then the reset myosin head, where the ATP splits ADP and pi by myosin ATPase. I don't know what that means. Okay, and then there's a all or none law, which is basically like if like the electrical excitation does not reach the I don't know what it's called. I forgot the word for it, but if it reaches the threshold, yeah, that's the word. Then it will carry on its function. If it doesn't, then it doesn't. Muscle twitch does not depend on that though. It depends on muscle size, fascicle arrangement, temporal summation, motor unit summation, how stretched the muscle was, temperature, pH, and the state of hydration. So yeah. As the voltage increases, more units are recruited to react. This is called recruitment and also multiple motor unit summation. If the frequency is increased further, the myogram exhibits incomplete tetany, which means the tension increases and twitch is partially fused. If the frequency is increased even further, then myogram exhibits tetany, which means the tension trace is a smooth line without relaxation. Isometric contraction is, although tension is increased, it is insufficient to overcome resistance. So the muscle length stays the same. So like when you're holding a weight, but your arm doesn't move. Isotonic contraction is that muscle tension overcomes resistance, resulting in movement. The tone stays constant, but the length changes. So I guess like when you stretch or whatever. Concentric contraction is muscle shortens as it contracts. Um, for example, when you're lifting a load. And then eccentric contraction is the muscle lengthen as it contracts. So, well, the first one is shortened, and eccentric is when it lengthens. So when you're lowering a load, it does that. Muscle cells can produce ATP via just regular aerobic cellular respiration, creatine phosphate, or glycolysis. There's also the lactic acid cycle. Oxygen jet is basically like the amount of oxygen you need to keep breathing in after exercise to restore pre-exercise conditions, which include replace oxygen on hemoglobin and myoglobin, replenishing glycogen, replenishing ATP and creatine phosphate, and converting lactic acid back into glucose. Oxidative fibers use cellular respiration, and these are fatigue resistant, and they have a lot of capillaries and mitochondria and myoglobin, and these are red. Glycolytic fibers are fatigable and use anaerobic cellular respiration. There are fewer capillaries, fewer mitochondria, small supply of myoglobin, and large glycogen reserves, and these are white. There are types of skeletal muscle fibers. There's slow oxidative fibers. These are slower, less powerful contractions, but higher endurance, and red. There's fast oxidative fibers. These are fast and powerful, primarily aerobic, And intermediate size and light red. They're fast glycolytic fibers. These are fast and powerful but brief, and they're largest, but they're white. Hand muscles have a high percentage of fast glycolytic fibers because they're quick. Back muscles have a high percentage of slow oxidative fibers to continue to maintain your posture. Long distance runners have a high proportion of slow oxidative fibers in legs, and sprinters have high percentage of fast glycolytic fibers. Exercise leads to better ATP production and glycogen reserves. Resistant exercise leads to hypertrophy, which is an increase in size. Atrophy is a decrease in size due to lack of use. Tetanus is spastic paralysis caused by Clostridium tetani, and overstimulation of muscles can be prevented by vaccination. Botulism is caused by Clostridium botulinum, prevents release of ACH at synaptic knobs. Sustained isometric contractions is associated with increase in blood pressure, and this is a concern for those who shovel snow a lot because of the cold and also like a lot of constriction. Myasthenia gravis is an autoimmune disease primarily in women, which involves like a lot of muscle weakness. Anabolic steroids mimic testosterone and stimulate manufacture of muscle proteins. It's a popular performance enhancer. There's a lot of side effects like risk of heart disease and stroke, kidney damage, liver damage, testicular atrophy, breast development in males, acne, high blood pressure, aggressive behavior, growth of facial hair in women, like a lot, bro. And there's muscular disorders which involve flaccid paralysis, curare, tetrodotoxin, botulism, myasthenia gravis, muscular dystrophy, spastic paralysis. I think I already, man, I already wrote that. Oh, there's different. There's spastic paralysis, tetanus. So spastic paralysis is tremor, seizure, and contraction, and flaccid paralysis is a state where muscles are limp and cannot contract. Smooth muscles have actin, myosin, and troponin. However, they can perform additional cross bridges and can perform latch bridges, meaning the myosin attach to actin for extended time without using extra ATP. There's calmodulin and myosin light chain kinase, which is MLCK, and myosin light chain phosphatase, which is MLCP, and they don't have sarcomeres and Z-disc, but they're in blood vessels, bronchioles, intestines, ureters, and uretus. And yeah, they have a long latent period. There's slow ATP activity, slow calcium pumps, last breed mechanism, fatigue resistance, low energy requirements, lacks limitations because of no Z-disc, and can contract forcefully. For example, like allowing you to empty your bladder regardless of the amount of urine. Okay, so for axial muscles, the superior attachment is more movable. The inferior attachment is less movable. For appendicular muscles, the proximal attachment is less movable, and the distal attachment is more movable. There is circular, parallel, convergent, or impennate or feather-like organization of fascicles. There is muscles grouped by primary actions: the agonist, the antagonist, which is the opposite of agonist, the synergist, which is like an assist or a fixator. So we got intramuscular injections. This is ensuring slower and more uniform delivery than IV or orally. There's idiopathic facial nerve paralysis, which is also known as Bell palsy. This is like one side of your face or one side of your body is paralyzed. There's muscular torticollis, which is a newborn with a shortened sternocleidomastoid. Head tilts to the affected side and the chin to the unaffected side. Hernias are a portion of viscera that protrude through weak point of the abdominal walls and is more common in males. Lateral epicondylis is also tennis elbows from trauma or repeated forceful contraction of forearm extensors. Carpal tunnel syndrome. The carpal bones and the flexor retinaculum has pins and needles. Shin splints is the soreness along the length of tibia. Compartment syndrome is the compression of blood vessels within a limb compartment. And shin splints is a type of compartment syndrome. Plantar fasciitis is the inflammation of the plantar aponeurosis and is a result of weight-bearing activities. So there's extrinsic eye muscles. There's 6 of them. There's 4 rectus and 2 oblique. The 4 rectus ones are the medial rectus is innervated by CN3, which is the oculomotor. Lateral rectus is innervated by CN4, which is the abducens. Inferior rectus is innervated by CN3, which is oculomotor. Superior rectus is innervated by CN3, which is oculomotor. And inferior oblique is innervated by CN3, oculomotor. Superior oblique innervated by CN4, which is trochlear. So, oh, sorry. Let me do that again. So the oculomotor muscles are the medial rectus, the inferior rectus, the superior rectus, and the inferior oblique. So the 2 different ones are the trochlear, which is CN4, which is the superior oblique, and then the abducens, which is CN6, which is lateral rectus. Okay, moving on to nervous system. The sensory nervous system is the afferent nervous system. It receives sensory information and transmits to the CNS. Somatic sensory system detects stimuli we consciously perceive. Visceral sensory system detects stimuli we do not typically perceive. Motor nervous system is the efferent nervous system and initiates motor output transmitted from CNS to effectors. The somatic motor system sends voluntary signals to skeletal muscles. The autonomic motor system sends involuntary commands to heart, smooth muscle, and glands, has the sympathetic and parasympathetic divisions. So there's 3 layers, of course. The epineurium encloses the entire nerve. The perineurium wraps the fascicle, which is the bundle of axons in a nerve, and the endoneurium wraps an individual axons. The neuron characteristics are excitability, conductivity, secretion, extreme longevity, and amyotonic. What? Parts of a neuron: there's the cell body, which is the soma, plasma membrane, which is the perikaryon, dendrites, and axons. Axons move material to and from cell body. Anterograde transport is from the cell body, retrograde is to the cell body. These are multipolar neurons, there's multipolar, which are many dendrites, which is the most common type. Bipolar has 1 dendrite and 1 axon. And unipolar neurons, which is also called pseudo-unipolar, is 1 process extends from cell body and split into 2 processes. Anaxonic neurons have dendrites but no axons. There's 3 types of neurons. There's sensory neurons, which conduct input from somatic and visceral receptors to CNS. Most are unipolar. Motor neurons are multipolar. These are efferent neurons. So sensory is afferent and motor is efferent. These conduct output from CNS to somatic and visceral effectors. Interneurons are association neurons, and these receive, process, and integrate information from other neurons, and generally multipolar. So I'm not going to talk about synapses. I'm not going to talk about... Okay, basically synaptic communication is a neurotransmitter molecule released from the vesicles into the cleft, and then the neurotransmitter diffuses across cleft, then binds to the postsynaptic receptors, and then the binding initiates synaptic potential, which is a graded potential. Synaptic delay is the time it takes for all these events to occur. There's a whole bunch of glial cells, which are found in CNS and PNS. They protect and nourish neurons. There's types of glial cells. There's astrocytes, which are the most abundant, and these control what substances have access to the brain, and they occupy the space of dying neurons. Epidermal cells line the cavities in the brain and spinal cords and also produce the cerebrospinal fluid. Microglia, they are phagocytic cells and engulf infectious agents. Oligodendrocytes are large cells with slender extensions and they wrap around the axons. So satellite cells and neural lemmocytes or Schwann cells are in the PNS. Mm, so this is the process of myelination, which is wrapping an axon with myelin. So the neural lemmocyte encircles neuron axon and wraps it in layers, forming myelin sheaths. Then the cytoplasm and nucleus are pushed into periphery, forming the neural lemma. Then the neural lemmocyte can myelin 1 millimeter of axon, so several are needed for one axon. Gaps between neural lemmocytes are neurofibril nodes, or nodes of Ranvier. One oligodendrocyte can myelinate 1 millimeter of multiple axons. Okay, I don't know what that means. So brain tumors arise from meninges, metastasis from non-neuronal tumors in other organs, glial cells that are mitotically active, gliomas that are highly malignant. Multiple sclerosis is when oligodendrocytes and myelin sheaths in the CNS deteriorate scar tissue. And so the nerve conduction is disrupted, so double vision, tremors, numbness, speech defects. The Guillain-Barré syndrome is loss of myelin from peripheral nerves due to inflammation. The Tay-Sachs disease is a hereditary disorder of infants in Jewish ancestry, and this leads to blindness, loss of coordination, dementia. Okay, so regeneration of nerve fibers when the nerve gets damaged. This can only happen if the soma is intact and at least some neurolemma remains. So first, the fiber distal to the injury cannot survive and degenerates, which is called Wallerian degeneration. 2, macrophages clean up tissue. Then the neural lemma and endoneurium form a regeneration tube. Then the axon stump sprouts in multiple growth processes. No, axon stump sprouts multiple growth processes. Then the severed distal ends continues to degenerate. The axon regenerates guided by nerve growth factors released by Schwann cells. Cool. Regeneration is extremely limited because oligodendrocytes secrete growth inhibiting molecules, not growth factors. There's a lot of number of axons that crowd the CNS, and regrowth is obstructed by scars from astrocytes and connective tissue. So neurons send signals down their length by electrophysiology, which is cellular mechanisms for producing electrical potentials and currents. So there's types of pumps and channels. Pumps are membrane proteins that maintain a concentration gradient by moving substances against their concentration gradient, and these require cellular energy. Some examples are potassium and calcium pumps. There are protein pores in the membrane that allow ions to move down their concentration gradients into or out of the cell, which is pretty open. Leak or passive channels are always open for continuous diffusion. Chemically gated channels are normally closed but open when a neurotransmitter binds. Voltage gated channels are normally closed but open when a membrane charge changes. Modality gated channels are normally closed but open in response to a stimulus other than a chemical or voltage change. There's 3 states of voltage change or voltage gated sodium channels. There's the resting state, which is a closed state. The inactivation gate is open and sodium is prevented from entering. The activation state means the gate is open and sodium moves through the channel. And then again, the inactivation state. So the activation gate is open and the inactivation gate is closed. So the entry of sodium is prevented. But this lasts like a short time before the channel quickly resets to a resting state. So the entire plasma membrane of a neuron has leak channels, like potassium leak channels, and then sodium and potassium pumps, and these maintain the resting membrane potential. We'll discuss that later. Ohm's law is current equals voltage divided by resistance, and so the current increases with larger voltage and smaller resistance. Let's talk about the resting membrane potential for a little bit. So basically, naturally, there's a higher concentration of potassium in the cytosol versus interstitial fluid. So there's more outside than inside. So there's higher, but there's also a higher concentration of sodium, chlorine, and calcium in the interstitial fluid than in the cytosol. So there's more of that inside than outside. Resting membrane potential is typically 70 millivolts. So the diffusion of potassium is the most important factor in setting resting membrane potential. So the potassium diffuses out of the cell due to its concentration gradient. And if this was the only thing that happened, then that would be 90 millivolts. But since there are a few like sodium leak channels, then a small sodium leakage means that the RMP is less negative, so leading it to be 70 millivolts because of that potassium. So gradient potential is small, short-lived changes in the RMP, and these are basically a polarization or hyperpolarization. So they're just like changes. So gradient potentials um a gradient potential in a postsynaptic neuron is called a postsynaptic potential. So a postsynaptic potential resulting in depolarization is called an excitatory postsynaptic potential, which is EPSP. A postsynaptic potential resulting in hyperpolarization is called an inhibitory postsynaptic potential, which is IPSP. Generation of EPSP are depolarizations caused by sodium entry. Generation of IPSP are hyperpolarizations caused by a exit of potassium or an entry of chloride. So this is basically the entire process of EPSP and IPSP at the axon hillock. So first, the voltage changes from the dendrites and the soma is added. Or yes, the voltage changes is added. Okay, whatever. And then the sum may or may not reach the threshold, which is negative 55 millivolts. But if it does, um, then the voltage gated channels are open and action potential is generated, which is conducted by an axonema of an axon. The action potential involves depolarization and repolarization. Depolarization is a gain of positive charge as sodium enters through the channels. So first, the voltage-gated channels are closed, but as sodium enters from the adjacent regions, the voltage-gated sodium channels open, sodium enters the axon, causing the membrane to have a positive potential. Then the sodium channels close, becoming inactive, and then after that, repolarization returns the cell to negative potential as potassium exits through the voltage-gated potassium channels. This involves depolarization. So it slowly opens potassium channels, potassium diffuses out, causing negative membrane potential. Then the potassium channels stay open for a longer time, so the exit makes the cell more negative than the resting membrane potentials. So the potassium channels eventually close, and as more, um, basically RMP is reestablished after that. Then the action potential is propagated down to the synaptic knob. Spatial summation is when multiple locations on a cell's receptive regions receive and generate postsynaptic potentials. A temporal summation is a single presynaptic neuron releases a neurotransmitter and produces multiple EPSPs. I want to sleep. Um, so continuous versus saltatory conduction. Continuous conduction occurs in unmyelinated axons. Can't read, bro. The charge opens voltage-gated channels. So salutatory conduction, not salutatory, saltatory conduction occurs on myelinated axons. Action potential only occurs at neurofibril nodes. The current becomes weaker with distance. So basically the saltatory conduction is much faster than the continuous conduction. and myelinated cells use less ATP to maintain their RMP. There's two types of nerve fiber groups. Group A has a large diameter and are myelinated. These are most somatic sensory neurons and all somatic motor neurons. Group B is a small diameter and are unmyelinated. These are some visceral neurons, some somatic sensory neurons from skin. Thicker fibers conduct faster than thin ones. Thick axons offer less resistance to current flow down the axon. Myelinated fibers conduct much faster than unmyelinated ones. Let's talk about some neurotransmitters. These are synthesized by neurons and stored within synaptic knobs. These are released from vesicles when action potential triggers calcium entry. These bind to a receptor in a target cell and trigger a physiological response in the target cell. There are four main chemical classes of neurotransmitters. There's acetylcholine. These are used in the PNS to simulate skeletal muscle and CNS to increase arousal. There's biogenic amines, which are also called monoamines. These are amino acids that are slightly modified to synthesize the transmitter. Catecholamines, which include like dopamine. These are made from tyrosine. Indolamines, um, example, are made from histidine or tryptophan. Amino acids include common transmitters glutamate, glycine, and GABA. Neuropeptides are chains of amino acids, 2 to 40 amino acids long, which include endorphins and substance P. Excitatory transmitters cause EPSPs. Sorry. Inhibitory transmitters cause IPSPs. Direct transmitters bind to receptors that are chemically gated channels, and indirect transmitters bind to receptors that involve G proteins and cyclic messengers. So, yeah, some drugs can influence transmitter removal. So SSRIs treat depressions. Galantamine hydrobromide is an ACH inhibitor, which is it treats Alzheimer's. Neuromodulators are chemicals that alter responses of local neurons. Nitric oxide can be a neurotransmitter or modulator. It is short-lived in a nonpolar gas and is made by postsynaptic neurons. It can include blood vessel dilation in the PNS. Endocannabinoids influence the same receptors that marijuana does. They are small and nonpolar and are also made by postsynaptic neurons, have effect on memory and appetite. Oh my gosh, last thing. So neuronal pools, which are also called neuronal circuits, these are groups of neurons arranged in specific patterns. And there's four types of circuits. There's converging, which means it converges at a single postsynaptic neuron. Diverging, which spreads information from one presynaptic neuron to several postsynaptic neurons. And reverberating, which use feedback to produce repeated activity. And it's active until there's an inhibitory stimulus or synaptic failure or fatigue. There's the last one is parallel after discharge, which is it's the input is transmitted simultaneously along several paths to the postsynaptic cell. Since paths vary in number of synapses, signal arrives at postsynaptic cell at various times, believed to be involved in high order thinking. Okay, well I pronounced everything wrong and I'm sleepy, so I just read everything that is needed to be read. So bye. I will probably make another useful stream soon, but right now I need to sleep.